Hello, I'm Dr. Rohan Yewale, Advanced Endoscopy Fellow at Dinanath Mangeshkar Hospital and Research Center, Pune. It's a pleasure to have with us Dr. Amol Bapaye, Senior Consultant and Lead Interventional Endoscopist at the Shivanand Desai Center for Digestive Disorders, Dinanath Mangeshkar Hospital and Research Center, Pune. On behalf of all our co-authors, we are here to discuss our study on the long-term composite gastroesophageal reflux outcomes of POEM with or without concomitant endoscopic fundoplication in a matched cohort of achalasia. So Dr. Bapaye, would you like to begin by telling us what is the exact rationale behind the study and performing the POEM-F procedure?
Thank you, Rohan, for inviting me to be here. We are all aware that peroral endoscopic myotomy or POEM is a well-established treatment modality for achalasia. At the same time, in the last few years, there has been a significant emerging concern regarding post-POEM reflux, with a reported incidence of as high as 40 to 55% reported in some studies. More importantly, most of this post-POEM reflux is often asymptomatic, as has been reported by earlier studies, and identifying and treating these patients can therefore be quite difficult. Asymptomatic reflux could further progress to stricture formation or predispose to Barrett's metaplasia in future. We need to remember that unlike its surgical counterpart, Heller myotomy, which is traditionally combined with an anterior partial fundoplication, standard POEM does not include a fundoplication to safeguard against post-myotomy reflux. In 2019, Professor Haru Inouye described a concomitant endoscopic partial fundoplication following an anterior POEM or POEM plus F procedure using a nodes approach. We were quite inspired by this technique and we started performing this procedure in our patients.
Could you brief us about the present study design and the patient profile, Dr. Bapaye?
Yeah, surely. So this was a single center retrospective matched case control study. 34 consecutive achalasia cardia patients undergoing POEM plus fundoplication during the study period were enrolled as an investigational arm. Each of these patients were matched with a suitable comparator undergoing a standard POEM during the same study period. Matching was performed based on age, gender, achalasia subtype, body mass index, prior interventions as well as ASA scores. Subtype 3 achalasia patients were excluded.
What were the outcomes assessed during follow-up, and were there any specific criteria used to define these outcomes?
Yeah, both the groups were followed up annually for 3 years. For GERD symptoms, details regarding PPI usage and dysphagia, of course. In addition to this, endoscopy and ambulatory 24-hour PS studies were performed to look for RAP integrity, grade of esophagitis based on the Los Angeles classification, and the acid exposure time. The primary outcome of our study was to compare the incidence of objective gastroesophageal reflux between these two groups as defined by the Lyon 2.0 consensus. Secondary outcomes included subjective reflux assessments based on validated symptom scores like the GERD-Q, the RSI and the GERD HRQL scores, and also the clinical success defined by an improvement in Eckhart scores to less than 3.
Right. Dr. Bapaye, would you like to highlight some of the key findings of this study?
So 34 patients underwent POEM plus fundoplication, and these patients were suitably matched with an equal number of POEM patients. At 3-year follow-up, conclusive reflux according to the updated Lyon 2.0, which means erosive esophagitis more than LA grade A or an acid exposure time more than 6% was demonstrated to be significantly lower in the POEM plus fundoplication group as compared to the POEM group, to the extent that 13.3% in the POEM plus fundoplication group compared to the 58.3% in the POEM group. However, at the same time, the incidence of symptomatic reflux and PPI usage, which signifies subjective reflux, was comparable in both these groups.
Were there any safety concerns or any particular adverse events noted in the POEM-F cohort in comparison with the POEM group?
None at all. Adverse events in both groups were very much comparable. The only adverse events that were noted was mucosal injury in 4 patients in the POEM group and 3 in the POEM-F group, all treated endoscopically. Safety of the POEM-F procedure has already been established in earlier studies by Professor Inouye and ourselves.
A lot of us may naturally wonder, is RAP integrity an area of concern in the longer run, Dr. Bapaye?
In our study, the fundoplication wrap remained intact in 76.5% patients at the end of 3-year follow-up.
Wow, that's really amazing to hear. But don't you think that the loop and flukes will eventually follow?
Rohan, let's understand this very clearly. During POEM-F, what are we doing? We are creating a wrap by fixing an endoloop on the serosal aspect of the gastric fundus using clips. This serosal surface is also abraded beforehand. The endoloop is further tightened to bring the serosal surface of the fundus into the submucosal tunnel. All this area heals after the procedure with peritoneal adhesion formation between the serosal surface of the fundus and the distal end of the tunnel and the anterior gastric wall. Adhesions typically take about 4 to 6 weeks to form and to solidify, and once they have formed, the wrap is going to stay in place over the long term. The clips and the endoloop are irrelevant beyond this period.
So what are the strengths, limitations and implications of the present study?
The highlight of our study is that it compares outcomes between these two cohorts after careful matching for several known factors which may be contributing towards post-POEM reflux. And also the second thing is that we have a meticulous follow-up with objective as well as subjective evaluation for reflux. Of course, we have a few limitations that this was a retrospective study design, it is a single stent study, and we had a only single operator for the POEM-F procedure.
Lastly, your closing remarks or the take-home message for our viewers.
This is the first of its kind study to compare and report long-term follow-up outcomes between POEM plus fundoplication and standard POEM. The incidence of objective reflux as per Lyon 2.2 was significantly lower after POEM plus fundoplication as compared to POEM at a 3-year follow-up, although subjective reflux remained low and comparable in both groups. The fundoplication wrap itself remained intact in 3/4 of our patients, indicating that the procedure is robust and durable.
Thank you once again, Dr. Bapaye, and thank you all for your valuable time.
Thank you.